Welcome to the deep dive. We take a whole bunch of sources, pull out the really fascinating stuff, and sort of tailor it just for you.
It's like the express lane to getting genuinely clued in on something amazing.
Exactly. And you've definitely brought us some amazing material today. We're diving into, well, it's a Reddit thread.
Ah, okay.
Medical pros sharing stories about the absolute rarest diseases they've ever come across.
Wow, okay. That sounds intense. Those are real first-hand accounts.
Yep. And look, we know our listeners have all sorts of backgrounds, some science folks, some just really curious people.
So we'll aim for that balance, right? Clear explanations, but still hitting those, mind-blowing details.
That's the plan. Make it clear, make it fascinating.
Okay, I'm ready. So the mission today is basically to explore these extraordinary, maybe even bizarre medical cases.
Yeah. See what doctors have encountered, get a glimpse into just how diverse human health can be, and maybe appreciate the challenges of diagnosis.
Sound like a plan. Let's do it.
All right, first one up, Pentalogy of Cantrell.
Ugh.
I'd never heard of it.
Me neither, actually. What is it?
Description is, well, it's hard to picture. A newborn baby, heart completely outside the chest.
Outside. How?
Because the sternum, the breastbone, it just hasn't fused together.
Whoa. Okay, that's immediately striking. How rare is that?
They estimate maybe 1 in 65,000 live births. So incredibly rare.
Tiny odds. Wow.
And the person describing it, they said you could see the whole heart beating, just hanging there,
Yeah.
attached by the main blood vessels.
Oh my goodness. Just visualized.
It's hard to even imagine, right?
Yeah.
They said the first thing they did was cover it with a polystyrene cup.
A cup. Just for protection, I guess, until
Yeah.
surgery.
Yeah, exactly. Just shows how fragile and urgent that situation is.
Absolutely. Immediate protection needed for a vital organ like that.
Then someone else jumped in, talking about a 9-year-old girl they saw with something similar.
9 years old, with her heart outside.
Apparently, yeah. Born somewhere with limited medical care. It was almost a miracle she even got to a place that could perform the surgery.
That really highlights the impact of, well, where you're born, doesn't it? Access to care is everything for these conditions.
Totally. What might be fatal somewhere could be treatable elsewhere.
Stark reality.
And this person saw the girl before the operation, could clearly see her heart beating right there in front of her ribs.
Just visible.
Yeah. And then, get this, when she coughed, they said it looked like her heart just completely changed shape.
Wow. I suppose without the rib cage holding its structure.
Right? The pressure just pushes it out of shape.
Yeah.
Such a vivid, visceral image.
It really emphasizes the protective job our skeleton does, doesn't it?
And the original poster added this interesting point contrasting that totally exposed heart muscle with other cases where maybe the heart at least had a skin covering.
Ah, that's a big difference. Still an anomaly, of course, but skin gives some protection, right, against infection, the environment.
Whereas a totally exposed heart or the pericardium around it, that's way riskier.
Much more immediate danger. Okay, what's next?
Okay, moving on. Un coup de sabre. Sounds like something from the Three Musketeers.
Huh, it does have that ring to it. French for saber stroke, apparently.
And it fits. It's a rare type of scleroderma causing this line, like a scar down the face,
Yeah.
like a sword cut.
Scleroderma, that's the autoimmune thing where skin gets hard.
Exactly. This is a localized form. But the extreme case they shared,
Wow. Go on.
a patient whose lower jawbone, the mandible, actually split in half from this.
Split the bone itself.
Yeah. Just shows how severe it can be, affecting deeper structures, not just skin.
That progressive hardening. The pressure on the bone must be immense. Incredible.
Next one. KID syndrome stands for keratitis ichthyosis deafness.
Okay, breaking that down, keratitis is eye inflammation.
Right, inflammation of the cornea. And in the case they shared, a 5-year-old girl, it had made her blind. Thick, opaque skin had grown over her eyes.
Oh, that's terrible. So the keratitis caused the blindness.
Exactly. And ichthyosis is the skin part, scaly, thick skin, and then deafness.
So 3 things, seemingly unrelated: eyes, skin, hearing, but all linked.
All from one root cause, which leads to the genetics.
Always fascinating. What's the gene?
It's a mutation in the connexin 26 gene. And here's where it gets really interesting, almost ironic, as one doctor pointed out.
Okay. Well, it turns out that missing the connexin 26 protein altogether, that's actually the most common genetic cause of being born deaf.
Wait, so missing the protein causes deafness?
But in KID syndrome, you have a mutated, malfunctioning version of the protein, and that causes the keratitis, ichthyosis, and the deafness.
Wow. So same gene, different error, totally different outcome. That's wild.
It is. And the commenter explained that this gene is active in the inner ear and the skin.
Ah, which explains why both are affected. Makes sense.
He connects the dots nicely, doesn't it?
Okay, shifting gears a bit. Into the mind-body connection area. Pseudocyesis.
Hysterical pregnancy, right?
Yeah, the story was about a woman in a prison psych unit. She genuinely believed she was pregnant with Jesus's triplets.
Okay, wow. That's quite specific.
And, incredibly, she had physical signs. Enlarged belly producing milk.
That's the power of pseudocyesis.
Yeah.
The mind convinces the body, triggering real physiological changes.
It's not just humans either. A vet chimed in.
Oh, yeah. Dogs get it.
Yep. Phantom pregnancies in dogs. Similar signs. Bigger belly, milk, and they might even start mothering things.
Like toys or...
Oh, someone shared a story about their dog adopting a potato as its puppy.
A potato. Okay, that's kind of adorable in a very strange way. But it does suggest a strong hormonal element across species, doesn't it?
Definitely seems like more than just belief, yeah.
Mhm.
Powerful biological drives.
For sure.
Okay, this next one sounds like horror movie territory. Gorham's disease.
Also called vanishing skull syndrome. That name says it all.
Right. A user described a patient who lost a softball-sized piece of their skull. Just gone, leaving a soft spot.
It's an incredibly rare condition where bone tissue just gets resorbed by the body, often for no known reason.
Resorbed, like dissolved away.
Essentially, yes. The body breaks it down and absorbs it. Can happen anywhere, but the skull is obviously dramatic.
Imagine needing a plastic plate just to protect your brain because the bone isn't there.
It's a very stark illustration of how crucial that protection is. Increases injury risk significantly.
And someone else commented their high school friend had it. That experience actually sparked their interest in medicine.
Wow. Shows how personal encounters with these rare things can shape lives, doesn't it? They're not just textbook entries.
Definitely not.
Yeah.
And someone asked, can the bone loss spread? Like, would they need a bigger plate later?
Unfortunately, yeah, it can be unpredictable. Sometimes it stabilizes, other times it keeps progressing, so adjustments might be needed.
Man. Okay, this next story. Genetics again, and just how much it can reveal. A young girl's genome sequencing broke the analysis system.
Broke this system. How? These pipelines are built to handle a lot of variation.
Well, the system checked sex based on Y chromosome, right? Absence means female. And then it looked at heterozygosity on the X chromosomes.
Heterozygosity meaning different versions of genes on the two X's, which females usually have.
Exactly. So this girl, no Y chromosome, looks female. But her X's had very little heterozygosity, almost none.
Which the system might interpret as male, having only one X.
Bingo. Conflicting signals. The system flagged it as totally anomalous.
Clever check they built in. So what was the reason for so little variation?
This is the really sad part. Turns out her parents were siblings.
Consanguinity. That dramatically increases the chances of inheriting two identical copies of recessive genes.
Reducing genetic variation overall. And in her case, so much so that it confused the standard analysis.
And likely caused her health problems, too.
Yeah, the user said she was very ill, multiple congenital issues.
Yeah.
A direct result of that reduced genetic diversity.
Such difficult situations. Ethically, emotionally. The clinicians knew the relationship, too, apparently.
Adds another layer, yeah. And the person sharing this, who works in clinical genetics, they reflected on just the sheer number of genetic diseases out there.
And the severe.
Yeah, and the emotional toll. Going from reading symptoms in a database to realizing these are real people suffering, often without answers.
It's a vital perspective. Behind the data are lives, families, facing huge challenges.
Absolutely. Okay, next condition is really tough. Harlequin ichthyosis.
Oh, yes. One of the most severe skin disorders.
A medical student described a newborn with it.
Yeah.
Skin like thick scales, cracking, peeling, essentially losing that vital barrier.
The name comes from that diamond pattern of scales, like a harlequin costume. But it's devastating. The compromised skin leads to dehydration, temperature problems, massive infection risk.
And sadly, survival rates are often low. The case they mentioned, the baby hadn't left the hospital in months.
Just highlights the constant intensive care needed and the immense difficulty in managing it.
Really underscores how critical our skin is, something we take for granted.
Absolutely vital.
Okay, another ichthyosis, but a different story. Lamellar ichthyosis, rarity about 1 in 600,000.
Still very rare. What was the story here?
A real genetic puzzle. A couple used a donor egg. Husband was a known carrier for LI, which is recessive.
So they needed an egg donor who was not a carrier to avoid the condition. Makes sense.
Right. And they specifically chose a donor tested and confirmed non-carrier. Seemed foolproof.
Should have been, based on standard recessive inheritance.
But the baby was born with a collodion membrane.
Which is a classic sign of lamellar ichthyosis at birth, like a tight, shiny film over the skin.
Exactly. Even at a major hospital, the initial doctors hadn't actually seen a case before, but it strongly suggested LI.
Which shouldn't have happened, given the donor testing. Creates a huge mystery.
So they did genetic testing on the baby. Confirmed. Lamellar ichthyosis. Got one mutation from the dad, as expected.
But the second mutation.
Seemed to come from the non-carrier donor, which, like they said, should be impossible.
Okay, genetic detective time. What happened?
The egg bank retested the donor twice. Still came back negative for known LI mutations.
Wow. So, still impossible.
Until a curious geneticist at the bank pushed for a third, deeper dive. And they found it.
On what?
A VUS variant of unknown significance in the donor.
Ah, so a genetic change was there, but its effect wasn't known at the time of the initial testing.
Precisely. And this VUS in the donor matched the second mutation found in the baby.
Okay, connecting the dots now.
The geneticist dug deeper, found this specific variant had only ever been recorded once before, worldwide.
Incredible rarity upon rarity.
And because of this baby's case, showing it clearly caused LI when paired with the dad's mutation, that VUS got reclassified.
From unknown significance to pathogenic disease causing.
Exactly. The baby's case literally advanced genetic knowledge.
That's a powerful example of how clinical cases drive understanding. Our knowledge is always evolving.
The poster calculated the odds of this happening at 0.0098%. Just staggering.
Truly highlights the limits of current knowledge and the need for ongoing research and data sharing. Amazing story.
Okay, next one is, well, quite unsettling. Fetus in fetu.
Right, where a malformed twin is found inside its sibling.
Yeah. A 10-year-old boy growing mass in his abdomen turned out to be a parasitic twin.
A very rare developmental anomaly happens super early in pregnancy when one twin essentially gets enveloped by the other.
The description was vivid. So the fetus had teeth, hairy limbs, curved nails.
Remnants of development, yeah. Didn't become a full fetus, but some differentiation happened.
Tragically, the 10-year-old boy started failing rapidly, passed away soon after admission.
Oh no, why?
Surgeons found they shared complex organ systems: stomach, liver, heart, blood vessels. Separation was impossible.
Ah, the parasitic twin was totally dependent, and surgery would have compromised the host twin. Devastating.
Yeah, and kind of a macabre detail, the parasitic twin was apparently donated to a Surgeons Hall museum.
First study, I suppose, allows people to learn about this extremely rare thing.
The thread then kind of touched on other twin things, like one being absorbed early or chimerism.
Where two individuals merge into one, two sets of DNA.
Right, fetus in fetu is like a step beyond that. The enveloped one persists, grows almost like a very organized tumor. They mentioned Craniopix parasiticus too.
Another disturbing example, yeah. A parasitic head attached to a developed body. Pushes the boundaries of understanding development.
And there was that related story about the Chimera mom whose DNA didn't match her baby's.
Oh, right. Because her uterus had DNA from a vanished twin she'd conceived. Wild implications for testing.
Totally. Okay, next. Fibrodysplasia ossificans progressiva, Pablo.
FOP. Ah, yes. The condition where soft tissue turns to bone. Exceptionally rare genetic disorder.
Muscles, tendons, ligaments. Just ossifying.
It's like the body's repair mechanism goes haywire. Any injury triggers abnormal bone formation where it shouldn't be.
A med student described dissecting a cadaver with FOP, feeling unexpected bony spikes in muscle, spine like a turtle shell.
That paints a picture. The extra bone severely restricts movement, leads to progressive disability.
And heartbreakingly, someone shared their sister has it. Misdiagnosis and surgeries when she was young actually made it worse.
That's the terrible paradox of FOP. Trauma, even surgery or injections, triggers more bone growth. So careful, conservative management is key.
Yeah, they mentioned early attempts to remove the bone were counterproductive.
Because you're not fixing the underlying genetic driver, and the surgery itself causes more trauma fueling the cycle.
The Motor Museum in Philly came up again. They have two skeletons showing advanced FOP.
A very stark visual of the disease's impact over time. Sobering.
And we got a comment from someone living with FOP just emphasizing the lifelong struggle.
Brings it home, doesn't it?
Yeah. And this really poignant detail. People with FOP might have to choose how they want to be permanently stuck based on where the bone forms.
Oh, wow. What an incredibly difficult reality. Constant adaptation and hard choices.
Okay, shifting to mental health. Cotard delusion. Walking corpse syndrome.
Yes, a rare neuropsychiatric
A
condition.
mental health pro shared about a patient who genuinely believed he was a zombie, convinced he was dead.
That's the core delusion. Believing you're dead, don't exist, or decaying, or lost vital organs. Being a zombie is a dramatic form of it.
The thread mentioned the Haitian zombie narrative tangentially, just regarding cultural beliefs about death and control.
Interesting cultural comparison, but distinct from the psychiatric delusion itself.
Right. Okay, next. Lesch-Nyhan syndrome, X-linked recessive, about 1 in 400,000.
Affects males primarily,
Hmm.
caused by an enzyme mutation involved in recycling DNA bits.
It has a few features, but the one that really stood out in the story was compulsive self-mutilation.
Yes, that's a very characteristic and distressing behavioral hallmark, along with neurological issues and gout-like symptoms.
The specific case. A patient had to have all his teeth removed.
To prevent severe biting.
Yeah, biting his arms and hands. And sadly, his brother had the same condition, same outcome.
Just awful. A drastic measure, but sometimes necessary to prevent catastrophic self-injury. Very challenging for everyone involved.
Next, a doctor shared experiences from an internship in a poorer region of Brazil. He encountered 2 rare genetic diseases while looking for something more common there.
What was the common thing?
Kala-Azar, visceral leishmaniasis. A parasitic disease from sandfly bites causes fever, enlarged spleen liver, low blood counts.
Right, prevalent in some tropical areas, can mimic other things initially. So what rare diseases popped up?
First, HERS disease, genetic disorder, reduces glycogen production in the liver.
Glycogen storage disease type Z. Trouble breaking down stored glucose leads to low blood sugar.
Exactly. Diagnosed in a baby with an enlarged liver and hypoglycemic episodes, which, interestingly, got better with breastfeeding.
Makes sense. Breast milk provides readily available sugar.
And the second rare one was Fanconi anemia.
Another genetic one. Causes bone marrow failure, right? Plus maybe physical anomalies, kidney issues.
Yeah. Initially suspected Kala-Azar because of low blood counts, but turned out to be Fanconi anemia.
Highlights the challenge, doesn't it? Diagnosing rare things when common diseases present similarly, especially with limited resources.
Absolutely critical to keep a broad differential diagnosis in mind.
Keen clinical eye needed.
Okay, back to eyes. Bilateral acanthamoeba keratitis.
Ooh, nasty one. Parasitic infection of the cornea. Acanthamoeba are common amoebas in water, soil.
Usually affects contact lens wearers with poor hygiene or water exposure. But bilateral both eyes is apparently extremely rare.
Exceptionally unusual, yes. The risk is much higher for contact wearers, but usually just one eye.
The patient came in with blurry vision, inflammation. Initially thought it was a flare-up of their underlying autoimmune uveitis.
Complicating factor. The pre-existing condition masking the new infection.
Turned out the cause was wearing contacts while swimming in a lake.
Exactly the kind of exposure that raises the risk. Hence the warnings. No sleeping, showering, or swimming in contacts.
And proper cleaning hygiene is vital.
Absolutely crucial.
The parasite apparently eats bacteria on the eye, then can start eating the eyeball itself. Yikes.
Yeah, it can be very destructive. There's often a characteristic ring shape seen on the cornea, too.
A key diagnostic clue for eye docs, I guess.
It is.
Then we got a quick rundown of some weird skin things. Chromidrosis.
Colored sweat. Rare disorder of the sweat glands. The user saw blue sweat.
Blue sweat. Okay. Then argyria.
Permanent blue-gray skin from silver overdose. Silver particles accumulate in the tissues?
And aquagenic urticaria.
Allergy to water. Contact with water, any temperature, causes itchy hives.
How do people even live with that? Showering, rain.
Incredibly challenging. Someone mentioned even drinking water can be uncomfortable, causes intense itching. There are online support groups.
Shows the huge impact these things have. Support communities must be lifelines.
Invaluable for connection and sharing coping strategies.
Okay, ears now. Objective tinnitus.
Where the ringing noise is audible to someone else, much rarer than the usual subjective tinnitus.
Yeah, in one case caused by middle ear muscle twitches after surgery. The eardrum acted like a tiny speaker.
Middle ear myoclonus, yeah. Those involuntary muddle contractions can produce audible sound.
Then, central deafness.
Deafness from brain damage, not ear damage. Affects processing sound, even if ears are fine.
Can affect speech, too. Deaf speech and memory. Maybe some recovery is possible.
Sometimes. It's damage to the brain's auditory pathways.
There was this wild anecdote. A patient's deafness got better when she went blind after a stroke, and vice versa.
Whoa! That points to incredible brain plasticity, how senses interact and maybe compensate in unexpected ways.
And the more common cause of audible ear clicking. Also, middle ear myoclonus, often linked to stress or jaw clenching.
Yes, those brief spasms are more frequent than true objective tinnitus from other causes.
Okay, super rare obstetric case. Leukemia developing in a baby while still in the womb.
Congenital leukemia is rare itself, but developing pre-birth, exceedingly uncommon.
Anti-NMDA receptor encephalitis came up too. Autoimmune, attacks brain receptors, causes psychosis. About 1 in 1.5 million.
Critical one. Can look purely psychiatric initially. Prompt diagnosis and immune treatment are vital.
One hospital saw 2 cases in a year, suggesting maybe it's underdiagnosed, people mislabeled.
It's a real concern. Need to consider medical causes for psychiatric symptoms.
Then, catecholamine-induced ventricular tachycardia.
Life-threatening heart rhythm problem triggered by adrenaline surges, exercise, fear, especially in younger people.
Scary stuff. Delicate electrical balance in the heart.
There.
And actual scurvy. We think of pirates, but this was an elderly man. Diet basically just biscuits after his wife died.
Lack of vitamin C still happens with severe dietary restriction even in developed countries.
Then this totally bizarre one. Spontaneous rupture of the cystic artery.
The gallbladder artery rupturing.
Yeah, but it ruptured in the small intestine. Caused massive internal bleeding. Patient just had mild abdominal pain initially.
Wow. Tiny artery, huge bleed, unexpected location. No surgeon there had ever seen it.
Shows how minor symptoms can mask something major and weird.
Absolutely. Need to be vigilant.
Malignant hyperthermia. Rare, dangerous reaction to anesthesia.
Genetic condition.
Yeah.
Causes a hypermetabolic crisis. Rapid onset.
An anesthesiology resident shared a scary story. And someone else described experiencing it during a tonsillectomy.
Both emphasize how fast it happens, the intense muscle rigidity, breakdown.
And how crucial the antidote, dantrolene, is.
Immediate treatment is life-saving. Critical for anesthesia teams to recognize.
Cerebral amyloid angiopathy-related inflammation. Okay, that's a mouthful.
Extremely rare inflammatory type of stroke disorder. Causes rapidly progressive dementia, small strokes, microbleeds with weird patterns.
So rare that even neurologists at a big academic center hadn't seen or heard of it.
Shows there are still rare subtypes even within common disease categories like stroke. Diagnostic challenges abound.
Persistent genital arousal disorder, PGAD.
Spontaneous, unwanted, distressing arousal and orgasms.
Yeah, the name sounds maybe not bad.
Yeah.
But the description emphasized the suffering, impact on life, sleep, mental health.
Exactly. It's not pleasant, it's disruptive and distressing. A real medical condition needing support.
One account mentioned successful treatment, therapy, lifestyle changes, social stuff, specific meds, a combined approach.
Good to hear multidisciplinary care can help manage this difficult condition.
Back to genetics. Prader-Willi and Angelman syndromes. The kicker. Caused by the exact same genetic mutation.
But depends which parent you inherit it from, right? Genomic imprinting.
Exactly. Angelman from the maternal mutation, happy demeanor, laughter, light features, severe disabilities.
And Prader-Willi from the paternal mutation, extreme hunger, obesity, milder cognitive issues.
Such different outcomes from the same genetic spot. Amazing. They also threw in Williams syndrome.
Right, the cocktail party personality, very charismatic, some cognitive impairment, but often good speech. Elf-like features sometimes mentioned, though they noted using sensitive language is important now. Good point. Terminology evolves. But these syndromes are striking examples of imprinting.
And then unnamed genetic disorders. So unique they don't even have a name.
Poses huge challenges for diagnosis, prognosis, everything. Mitochondrial DNA depletion syndrome was another rare one mentioned.
We heard from a parent whose daughter has one on the ZBTB18 gene. Only 2 other known cases on that gene, but not exact matches.
So it's often wait and see, track development, hope research connects similar cases over time.
Exactly. Ongoing effort to link patients with common traits, even if the exact mutation differs slightly.
Crucial work for advancing understanding in these ultra-rare situations.
Leprosy popped up. Surprisingly, encountered in North America.
Less common than places like Brazil, but it occurs. Sometimes linked to handling wild armadillos in the U.S. South.
Armadillos. Didn't know that. Goodpasture syndrome next.
Autoimmune, attacks lungs and kidneys, about 1 in a million.
Someone shared being diagnosed at 4, kidney transplant at 6. Wow. Also mentioned having situs versus dextrocardia.
Mirror image organs. Interesting co-occurrence of 2 rare things. Goodpastures needs prompt treatment to save organ function.
Alpha-gal syndrome got a mention. The red meat allergy from Lone Star tick bites.
Becoming more recognized as the ticks range expands. Delayed reaction makes it tricky sometimes.
And then polycythemia vera with spontaneous bleeding. Too many red blood cells.
But the body was kind of self-treating with a chronic hidden GI bleed until that balance got upset.
Yeah. Wild compensatory mechanism.
Remarkable, if not exactly ideal long-term.
Numb chin syndrome.
Numbness in chin lower lip can be nothing or a sign of malignancy recurrence, like leukemia.
And a med student actually diagnosed relapsed leukemia based just on that numb chin.
Great clinical catch. Shows seemingly minor signs can be vital clues.
Some quick rare obstetric cases. A pre-viable baby with cyclopia and proboscis.
Single eye, tube-like nose structure, devastating developmental issue.
A healthy baby born with 5 true knots in the umbilical cord.
Wow, 5 is a lot. Usually knots cause problems when mating the baby was fine.
And severe polyhydramnios, way too much amniotic fluid.
Can indicate underlying issues or just be idiopathic. Shows the spectrum of pregnancy events.
Complete androgen insensitivity syndrome, CAIS. A 23-year-old biologically male, XY, presents with no menstruation.
Because their body is resistant to androgens like testosterone, leading to different sexual
A
development.
bizarre surgical complication. Connection formed between the stomach and the sac around the heart after multiple surgeries.
Pericardial sac. That sounds like a recipe for disaster. Life-threatening emergency, yeah. Shows how healing can sometimes go wrong in unexpected ways after complex procedures.
Aseptic meningitis, looking like psychiatric illness.
Patient had new psych symptoms, turned out to be non-bacterial meningitis, inflammation around the brain.
And possibly linked to antidepressant use in that case, which is rare but known. Highlights diagnostic challenges.
Absolutely. Need to rule out medical causes for psych changes, consider drug effects too.
Rare parotid gland cancer presenting subtly. Jaw pain. Bell's palsy.
Cancer of a salivary gland, less than 1% incidence. Subtle signs mean you need high index of suspicion.
Trusting clinical intuition sometimes.
Can be key in catching rare things early.
Visceral leishmaniasis again. But this time in a U.S. toddler. Usually found elsewhere, like Azerbaijan.
Highly unusual location. Diagnosis needed travel history. Family insight, bone marrow tests.
But treatment worked dramatically. Shows importance of history and specialized tests.
Definitely.
And maybe the weirdest one. A dentist found a germinated mustard seed growing in a tooth cavity.
A mustard seed. Germinated. In a tooth. Okay, that's unique. How does that even happen?
No idea. Intrauterine amniotic banding next.
Strands from the amniotic sac constricting fetal parts in the womb, causing deformities?
Limb, digit problems, depending on where the bands tighten, can be severe.
Tragic consequence of development gone awry.
Breast cancer found by accident in a male patient.
He had a benign lump-checked comparison mammogram of the other breast found early cancer.
Highlights that men can get breast cancer, though it's rarer, and coincidental findings happen.
Thorough exams are key.
Granulomatosis with polyangiitis, Wegener's in a 4-year-old. Nonspecific symptoms plus a saddle nose.
Autoimmune affects airways, kidneys, vessels. Elevated creatinine, kidney function, clinched the diagnosis, now called GPA.
Side neglect after stroke.
Fascinating. Becoming unaware of one side of your body in space, even if senses work, a cognitive awareness issue. Brain's representation of self and space gets disrupted.
2 uteruses, twin pregnancy in each uterus simultaneously via IVF.
Uterus didelphys, carrying twins, one in each uterus. Extremely rare event.
And another patient who naturally conceives twins in all 4 of her pregnancies.
Statistically improbable. Remarkable reproductive variations.
Scurvy again. Patient with OCD and agoraphobia, diet restricted to noodles and ramen.
Reinforces that severe dietary limitation, for whatever reason, can lead to classic deficiencies.
Fournier's gangrene mentioned briefly. Severe genital infection.
Nasty, rapidly progressing. Urological emergency needing immediate surgery.
Mold growing from brain tissue.
Yeah, common environmental mold, alternaria, in an immunocompromised patient. Opportunistic infection. Fungi that are usually harmless can be deadly when immunity is down.
Argyria again. Patient self-treating with colloidal silver.
For a self-diagnosed prion disease based on a grape juice test, oh dear.
Yeah. Result, permanent blue skin. Cautionary tale about misinformation and unproven treatments.
Absolutely. Rely on evidence-based medicine.
Ehlers-Danlos syndrome in a cat.
Veterinarian diagnosed it. Connective tissue disorder, stretchy, fragile skin, affects collagen, can occur across species.
And lastly, Margolin ulcer.
Aggressive skin cancer developing in old burn scars or chronic wounds. Rare but serious complication.
Wow. What an incredible journey through the truly astonishing landscape of rare diseases. It's just mind-boggling to consider the sheer variety and the incredibly unexpected ways that human health can be affected.
It really does underscore the unbelievable complexity of the human body, doesn't it? And how